Hey guys, I get a lot of questions about BPC and TB500. What are they? How do they work? How do I inject it? Where do I inject it? How much do I inject? What about the frequency? So I'm going to cover those questions for you today. Now we do have these peptides in other forms. We have it in nasal form, we have it in oral form, and we do have the peptides in a topical form. We have them standalone, so BPC-157 independent by itself, and we also have TB500 independent by itself. We also have them as a combination. I'm a firm believer that in my own practice and application with using these two peptides and pairing them together, I've seen significant results as far as improving with health, when it comes to healing, when it comes to inflammation control, pain control. There's tremendous benefits within these two peptides. And again, I want to go over some of the basics on how to do the constituting and things of that nature. So the first thing you're going to do is you're going to need to have some bacteriostatic water or backwater. You can get reconstitution solution. I use backwater. I get this right on explicitsarms.com. From there, we're going to take our fresh vial of the BPC-157 and TB500. Now you'll notice it's a 5 milligram vial. What does that mean? That means it's 5 milligrams of each active ingredient. You can, by all means, have a bottle of BPC-157 and a bottle of TB500 and separately constitute and put them in a single syringe and inject them, or you can just do it in one. We're just doing it in one and makes our life a lot easier. What we're going to do is we're going to pop the top off. Okay, top is off. We're going to have to constitute it and put this bacteriostatic water inside of this vial. So what we're going to do is this. These are always going to be sterile syringes. We're going to pull. You don't have to do this. So what we're going to do is we're going to pull this to 100 units. Now we don't always have to do this, but I like to do this. It just helps me put a little air in this, gets a little more pressure there. When you pull it out, it helps put the liquid in here. So we're going to put it in the middle here. Okay. And push the air in there. Look, without me even pulling, it's pulling it out organically. Okay. I'm going to finish doing the job for it and pull this bad boy out organically. We're going to pull it down to 100 units. Now, when you're getting these syringes, okay, we're at 100 units, you're always going to want to get the 1 milliliter or 100 unit syringe. You can see I went in a little sideways. The needle head is a little crooked. 100 units, these are 1 milliliter or 1 cc syringes. So we're going to put 100 units, aka 100 units or 1 milliliter or 1 cc of water into this. Now, when you see this, you'll see a little valley in the middle. Now, again, these are sterile. We just pop the tops off, so I don't have to use the alcohol swabs to sterilize them because they're already sterile. After I do this, and once I store it, which when you're done doing this, you always want to store it in a refrigerator. Then I will need to swab it again before I pull the compound out with a new needle. Always use a new needle. You're going to lose the sharp of the tip, and you don't want to cross-contaminate any kind of bacteria, because what could happen, if there's bacteria dormant on there, you can push that bacteria in here. It's going to grow in that liquid, and you don't want that to happen. So it'll ruin everything. Right now it's sterile. We're going to put this in here. You can see the valley, and we're going to do it at an angle. I like to put the water against the glass first. This is a very fragile compound. All of these peptides are fragile compounds. Okay, so when we do that, now the first thing you're going to do is cap your needle. I've been stuck one too many times by myself. When you put the cap on, go slow. You're going to discard this needle. So now what do you do with this? Because you have a powder that has to be constituted. We generally want to shake things up. You don't want to shake it. It's a slow roll. Slowly roll this thing. Eventually it'll dissipate. Now, even if you don't roll it, it will dissipate. If you want to get there fast and you're impatient like me, you could roll it, but don't shake it. They're fragile compounds. And this process, what I'm doing right now, is called the constitution process. Also notice my fingers are not on the top, it's just on the sides, so that I'm not getting bacteria on the rubber, where I'm then going to have bacteria contaminate the actual compounds inside the vial. Now it's finally dissipated. The next question is dosing. How do I dose it? If we don't have these two compounds together, what you're going to want to do for dosing, generally it's going to be 2 milligrams or 2.5 milligrams of the TB500 administered 2 times per week, and the BPC anywhere from 250 micrograms daily up to 500 micrograms daily, or every other day. Because we have a combination of the two peptides, 5 milligrams of each, it makes the most sense, and I've actually noticed more benefit from microdosing the TB500 more frequently at 500 micrograms every other day. You don't want to pen daily at the 250 micrograms. For dosing, what we're looking at is either 250 micrograms of each compound daily or 500 micrograms of each compound every other day. That means that a vial like this is going to last you 20 days. Regardless of how you dose it, whether it's 250 every day or 500 micrograms every other day, it's going to last you 20 days. But Tim, how do we get to 500 micrograms? Great question. I'm gonna walk you through the process. Let's do some simple math. If this whole vial is 1 cc of backwater, or 100 units, so remember, 1 cc equates 100 units. And if this whole vial is 100 units, and we put that in there, and that's 5 milligrams of each compound, and a milligram is equal to 1,000 micrograms. You can also go to Google and just type this in. There's like a peptide calculator, but we'll do it old fashioned. We're gonna get out our handy dandy calculator. What we're gonna do is 5,000 micrograms, 5,000, and we're gonna divide that by 100, and that means every 1 unit is 50 micrograms. What does that mean? Well, 50 times 100, oh wait, that means 10 units is gonna be 500 micrograms. It's like magic. Call me Harry Houdini. Right there, guys. 10 units, 10 IUs is 500 micrograms. How do we inject it? Well, there's a couple different ways. I've had this injury where my TFL on the outside of my right quadricep, my right leg. In 2021, I was doing a prep for nationals. I was running DNP, which I don't suggest anybody ever run that. It's a very dangerous compound. You'll lose a lot of fat. I lost 30 pounds in 30 days by doing no cardio, but it's a very dangerous compound. I'll never run it again. It dries out the mitochondria of the muscle. And in doing that, I got 2 injuries within the same week of each other. I tore something in my shoulder and also tore something in my leg, TFL. I had knee surgery this year in 2024. That was in 2021. I had knee surgery this year, so I've been going easy ever since June. And I finally got to a place where I was squatting heavy again. I was building my strength up. I felt good. I did 585 for 2 ATG. If you don't know what that is, Google it, ATG. 585 for 2, and I felt really good until about 4 days later, and all of a sudden I said, oh no, I'm feeling a lot of pressure at that TFL spot again. Because I have that issue, I'm gonna run the TB500, the BPC 157 at 500 micrograms of each compound every other day. Now, normally, if I wasn't videotaping this, I would say I'm gonna put it right in that area, the affected area. Now, from a systemic standpoint, meaning, working throughout the whole body, if you don't have a huge injury, let's say you have a couple different injuries, I would always recommend subcutaneous, which I'm gonna demonstrate to you how to do here in a second. But if you do have an acute injury, this is where going directly into that area, the affected or injured area would be beneficial, as long as you have good muscle tissue there or fat tissue there. If it's a joint, like your wrist or ankle or something like that, I would recommend going to the stomach fat subcutaneous injection. We're gonna pretend that this has been used before, even though it hasn't, and we're going to sanitize this. Okay? Sanitize that. Now that's nice and clean. The next thing we're gonna do is sanitize our injection site, which is gonna be my belly. That way, no bacteria can get in there, and we're not leaving any room for any infection or things of that nature. Okay, now remember guys, our unit of measurements. If we're doing 500 micrograms of each, that means 10 units. We find that little valley in the middle. See a little valley there? We're gonna put our needle right in there, or syringe, and we're gonna pull out. And this is, I didn't pressurize the syringe. This is why it's important to pressurize it, so you're not sitting here literally watching it drip out. It just takes an extra 10, 15 seconds. So now that we got the 10 units, we're gonna pull up, holding our finger like that the whole time, not allowing that vacuum to pull the liquid back into the vial. So now we're going to inject this into the belly. Guys, it's a tiny little pinch. It does not hurt. You wanna go about an inch, sorry, my beard's in the way. You wanna go about an inch away from your belly button. You're gonna pinch the skin just like this. You're gonna go about an inch away from your belly button. Slowly put it in. Okay, once it's in there, you're just gonna push the liquid in. Okay, once it's all in, we're gonna slowly pull it out. You're gonna take that same sanitary pad, alcohol pad, or whatever you have for alcohol to clean, and you're gonna wipe it. It's that simple. Remember, cap it and discard it. Now the frequency, like I said, is gonna be either daily or every other day. If you're gonna do 500 micrograms, you can do and guys, you can do 500 micrograms a day, you're just going to run through it faster. In the research and studies that I found, there's no need to do more than either 250 micrograms daily or 500 micrograms every other day. As far as the length, the duration of time, how long are you supposed to take this BPC 157 and TB 500 for? 6 weeks, 8 weeks if necessary, 4 weeks if it's healed by then. I would say anywhere between 4 and 6 weeks. If you have to maybe do an extra 2 weeks, you can, but there's really no need to go longer than 8 weeks. Does it actually work? Yes. We have customers, I'm not going to release their names for confidentiality reasons. We have an elderly couple who is on a subscription plan from explicitsarms.com, and they are on literally this exact compounds right here, this exact vial. It's the TB500 and BPC 157. The gentleman, he is, I believe, 70, in his early 70s. Both of his rotator cuffs are completely torn. There's no connective tissue in between, and apparently his wife is explaining to me that he's very hard hard-headed and stubborn. So he went to 2 or 3 different doctors, got MRIs done, imaging, and they said that no, he needs to get surgery done. Being old and stubborn and hard-headed, he said, I'm not doing that. I will heal myself. And where he landed on explicitsarms.com. After 2.5 months of taking that, his wife had some sort of cancer in her groinal area, and she was left with keloids, so scarring tissue of the groinal area. She was on the exact same thing. After 1 month of her using this and 2.5 months of him using it, within 1 month, her scars were completely gone, and doctors could not believe it. Within 2.5 months, there was tissue, connective tissue, ligaments that were rebinding to themselves. Before, he couldn't lift his arms past here. Now he can lift his arms almost over his head. The proof is right here in the peptides. You don't have to listen to me. I'm not trying to sell you something. I'm just showing you what has worked for me and worked for hundreds and hundreds of our customers. We see it on a daily basis in our retail store. We see it on a daily basis on our online stores, and it truly is amazing. If there's a miracle, I can't call it something because it's not. If there's a miracle potion out there, it would be this. That's the in and out of the TB500 and the BPC157. If you have questions further than that, let me know. If you don't know how to dose other stuff, let's just say like CGC DAC or CGC157 no DAC. Again, guys, it's simple math. Use simple math. Use a calculator. Go to, I think there's like a peptidecalculator.com. If I wanted to run a 200 micrograms or 500 micrograms of CJC daily, you just take the total amount, which is 5,000 micrograms, regardless of how much liquid is in here. It's always going to be 5,000 micrograms, and then you just do some simple division. So let's just say I put a cc of bacteriostatic water in here. If I want to do 500 micrograms, I'm going to do what? I'm going to pull to that 10 mark. Let's say I put 2 cc's in there for whatever reason. I'm going to do what? Pull to that 20 mark, because 20 is now going to equate 500. So if there's questions beyond this that you do have, please reach out. We have a phone number. We have a website. You can reach us at our retail location at any given day. We're here 7 days a week, and we love to help people. We want to help you. We want to help you heal. And these compounds, I'll tell you one more story. A recent guy, one of our regular customers, his son's been coming here for 5 years, almost 6 years. He had horrible plantar fasciitis to the point where it was debilitating. He couldn't work. He couldn't walk. He reached out and said, hey, Tim, does that cream work? And I said, I'm not going to sell you on it, but I can tell you that all of our customers that have tried the TB500 and BPC157 cream work, and it works amazing. You do 1 to 2 squirts 1 to 2 times per day. It does come out in a very loose consistency, so just beware. He said after 2 days, he was almost at 100% from where he was, and he was back to work. So again, don't take my word for it. The proof is in